Welcome to our lecture on pathological gambling. I hope that you all are doing well and are enjoying learning about processed addictions thus far. So what is pathological gambling? Pathological gambling can be referred to problematic gambling, compulsive gambling, or pathological gambling. These terms are used synonymously within the clinical and fields of addiction. So it can begin when there's a progression in the amount and or frequency of the gambling. The gambling becomes consuming of other aspects of life, and the individual does not do it for recreation anymore, but to fulfill a need. So it may have certainly started for recreational purposes because we know that gambling is very much a social thing. It could be a thing that people do on occasion, but it turns into habitual for those who develop a gambling addiction. It could have started in childhood when, a kid could have gone with their mom and gone to bingo, or they could have played some sort of betting games with their friends. Eventually, they begin going by themselves and in secret, and that's when the lying starts to begin, such as opening up secret credit cards. They may lie about their whereabouts, and it may actually get to the point where their actions become illegal, such as embezzling money or opening up a credit card in someone else's name. And this is when the desperation starts. It becomes more and more. So with the progression, maybe they might be betting more money, or there may be an increase in monetary value, as well as not only the amount of money that they're gambling, but the amount of time they're spending gambling. So this sounds like tolerance in a way, in its own way. It's much more talked about now, fortunately. Before, it was thought as people just being irresponsible or not knowing how to manage their money. Now it's actually recognized as a disorder in the most current DSM, which is the DSM-5. The symptoms are very much similar to that of substance abuse. So needing to gamble progressively larger amounts of money to feel the same or get the same feelings of euphoria or excitement, having made many unsuccessful attempts to cut back or quit gambling. They may feel restless or irritable when trying to cut back or quit gambling. There's a preoccupation that often comes with it. So excessive thoughts about gambling, their previous gambling experiences, planning the next time they're going to gamble, and what they're going to do when they achieve their gambling goal. So maybe they fantasize about winning a large amount of money. They're usually lying about the amount of time spent on gambling. They might have lost a job, relationships, or even educational and career opportunity. They may get so desperate that they rely on others to borrow money or to get by due to gambling losses. And something that's different with gambling versus like a substance use addiction is the intermittent reward. So the gambler doesn't know what's going to occur, right? They walk into the casino and it's the unknown. Whereas with alcohol or drug use, they know that if I use this amount of alcohol, I'm going to get high or I'm going to get drunk. They pretty much know the outcome or the feeling that it comes with. But the gambler, sometimes people are addicted to that unknown feeling, and they don't know when the reward is going to occur. So it becomes not about losing, but it becomes about the anticipation. So sometimes it takes one time at the slots, others it takes 30. They might become superstition, and they get so desperate that they start to have this magical thinking or obsessive compulsive habits. So you might, if someone's betting on some type of game, they might say, oh, the remotes have to be this way, or I have to be wearing this shirt. It's very superstitious, and this is maybe someone's way of having control over the situation or trying to control the situation. These irrational cognitions develop, and they may start to have illusions that they could win. It's known as a hidden addiction, as is a sex addiction. So with drugs and alcohol, you know when someone is high. They can't hide it. I mean, sometimes maybe, but for the most part, their loved ones are going to be able to tell. Like sex, you wouldn't know that gambling's a problem, right? It could be done in secrecy. So where with substance use, there's the blame of the drug. So I acted that way because I was high. But you can't smell craps on someone's breath, right? So you would have no idea if someone had gone to the casino. They could hide it very well, whereas substance, it's very much so explicit. The denial here, some say, is much greater. They look at it as, I have a financial problem, I don't have a gambling problem. So if I just win money, then my problems are over, right? I just need to win more because then my financial problems will be taken away because that is my problem. One winning streak or one lucky bet can erase this problem. So there's a lot of denial there, whereas it's not the gambling that's to blame. It's I just have financial problems. In a way, it's also a lot like eating disorders and sex addictions because someone has to be able to handle their money, right? Finances are just a part of life. So they must learn to have a healthy relationship with money. But on the flip side, it can be a lot like substance use, whereas these people are getting a rush and they get something that's actually very close to a cocaine high, which is, if you read your article assigned for this week, you will learn about the brain, how the brain actually changes when someone's a pathological gambler and they are thinking about going to a casino or walk into the casino. It, triggers those neurotransmitters that we talked about. And something else that is noteworthy would be that it looks less like a disease to people because, with alcohol and substance use, there's a medical condition that often comes with it. Same with eating disorders. So there's a lot of overlap in this area too, whereas it does not necessarily affect you physically unless, of course, someone has a comorbid substance use problem, which we'll get to that. And the last thing I want to note on this slide is that gambling is almost unlimited in a sense. You could only drink and use so much drugs. So, if you drink too much or use too much, there's the potential of fatality, right? You could overdose. Where gamblers can use an astronomical amount of money. And, the casinos are encouraging it too. So there's a severe, with relapse, it's a lot more. I'm not trying to minimize substance use because that's very big too, and there are long-term consequences, especially with relapses. But, you could blow a lot of money in a very short period of time. So I want you to kind of think about that. So prevalence, gambling addiction is a significant problem in the US. It's actually becoming more of a problem. It's impacting adults of all ages. It affects 1 to 3% of adults, usually men more often than women. It usually begins in adolescence. And until recently, legal casino and sports betting were limited to a few states. So now there's a lot of growth in riverboat and Indian casinos, which is interesting. And older adults are perhaps more vulnerable than other age groups given their greater dependence on fixed incomes and more limited ability to recover from gambling losses. And I want to point out the difference between there are two forms of gamblers: action versus escape gambling. And you could think of this as kind of like a style, like an upper and a downer, kind of like we use with drugs. Cocaine is an upper, while and meth is, an upper, while heroin is a downer. But both of these are escaping in some way or another. But the action gamblers, they become addicted to the euphoria or high that they feel when they are performing well, and other people at the casino are recognizing their successes. So they are very much addicted to being the center of attention, feeling like they're powerful. They may get an empowered feeling that they don't have in other areas of their life. So these people often are doing like the horse betting or big bets. They could go on an action binge, which would look like kind of like a cocaine high, where they like the thrill, the attention, the limelight is very enticing to them. And they're good at it. So it gives them a sense of control when they may feel out of control in other areas of their lives. And the escape gamblers, are seeking to numb or escape anxiety, depression, grief, or loss by disconnecting with the real world. So it's almost, I've heard it described as, I worked with one client who had a gambling addiction. He described it as he would be sitting on the slot machine, and he used the word being on autopilot, where he wasn't really there mentally. So to me, that I term that in the clinical kind of world, that would be like a form of disassociation, right? He was almost even having like a out-of-body experience where he was so disconnected that he forgot about, he was even disconnected to his sense of being thirsty, his sense of being hungry, his sense of the need to go to the bathroom. So he was so kind of in the zone and almost hypnotized, which is disassociation, that all this time passed and he wouldn't even realize it. It could get that severe. Senior gamblers are usually escaping grief. So a senior citizen can be gambling to escape the pain of a loss of a loved one, perhaps. There is comorbidity. So about 2/3 have substance use disorders, which, if you think about it, makes sense. They have a lot of opportunity because there's a lot of free drinks involved. As long as you're gambling, you get free drinks. Smoking is big in casinos. There are mental health issues that come along with this. About half of gamblers struggle with a mood disorder, so like depression, and about 40% struggle with anxiety. Much like substance use disorders and sex addictions, problematic gambling provides a behavior for the individual to process their emotional trauma or anxieties. So it's the same core issue there. So pathological gambling usually begins in early adolescence in men and between 20 and 40 in women. Pathological gambling seems to be similar to disorders such as alcohol and drug addiction, but there are also differences like we talked about. In people who develop this form of process addiction, occasional gambling leads to gambling as a habit, and in turn turns into their way of coping. So treatment is a little different in ways, similar in a lot of other ways. But I just kind of want you to keep in mind that it's hard to recognize whether someone's being honest unless you're hearing from a third party or some type of collateral. But there's no, just for drugs, we have tests, right? Oh, did you use this week? Let me drug test you. For gambling, we don't have that. When gamblers stop, there's no physical recovery. So no physical impairment in gambling like there is in a recovering drug user. So there is oftentimes they're entering treatment due to a financial crisis. So it's not necessarily, they're more in that pre-contemplation phase. So they're not necessarily naming their problem, but they're in a state of crisis financially, or they may have received like an ultimatum from a loved one, or I'm here because my wife wants me to be here. I'm here because my husband wants to be here. So sometimes it takes some time to really get them to recognize their problem and name it. So you have to, just like with other forms of treatment, and we have to meet them where they're at, right? So I think a good place to start would be, what does gambling do for you? What do you like about it? And go from there. There's an insurance barrier, though, unfortunately. Companies do not recognize gambling addictions as something that their plan should cover, and a significant portion of gambling addicts reach out for professional help at the urging of the family members, the criminal, so they might be in trouble with the law, so they might be mandated to treatment, or out of sheer desperation. So another barrier to getting help is insurance and the financial situation, because we know that these individuals usually aren't in a good financial position. So during the therapeutic process, the counselor should help the individual process what benefits they gain from gambling, like I said, and determine alternate ways to achieve these goals, such as coping skills, accountability, relationships, or other resources available. But we know that we have to work through that trauma, or whatever they're avoiding, they have to face it in order for them to move away from all process addictions. Because if they just abstain from gambling and don't work on the root of the issue, the new process addiction is likely, or substance addiction is likely to pop up. So there's individual and group psychotherapy. There are self-support groups such as Gamblers Anonymous. Some of you might choose to attend one of these. Abstinence principles that apply to other types of addictions, such as substance abuse and alcohol dependence, are also relevant in the treatment of compulsive gambling behaviors. And recently, there have been medications such as antidepressants, opioid antagonists, and mood stabilizers that have shown to be beneficial in combination with psychotherapy. So, like with anything else, a combination of therapy and medication is probably the most effective. And prevention. So it might not always be possible, but someone who is prone to addiction should be limited to their exposure. This starts with psychoeducation. And I also wanted you guys to be aware that March is National Gambling Awareness Month. So that I think is wonderful because it's being recognized. So there are a lot more resources. There's hotlines. There are websites that we may go to if ourselves or a loved one is struggling. So it's, like I said, a lot more talked about, which is really wonderful, because before it was kind of shamed on and there was a big stigma to it that came along with it. So I have a few videos that I'd like you to watch. One is a little longer, one's shorter, and let's see. I will post these videos separately, so all you'll have to do is click the link on Blackboard. If you have any questions about gambling, anything that you're confused about that I did not cover, or the article or the reading does not cover, please feel free to ask in the forum or in an email. And I will see you guys in the next lecture. Take care.